Hello students, in the current topic I am going to explain about the condition arthritis. So let's begin. Arthritis. Arthritis refers to a group of disorders affecting joints, causing pain, stiffness, swelling and reduced function. It includes inflammatory and degenerative diseases and may affect people of any age. Here it is said that it can affect people of any age, but what happens is that mostly elderly people are getting affected with this, and they also have in this condition what happens that they have also with the problems of swelling, and their function get reduced. They complain of pain, and they also complain about stiffness. They cannot move the joints. So these all are the symptoms we can see in the people who are affecting with arthritis. Actually, arthritis is a joint disorder which affects the joints of the joints, and then it affects the walking, or mostly elderly people have complaint of knee pain, joint pains. These all symptoms occur because of the uh, disease or condition of arthritis. So here it is just an overview of what arthritis is. To the next slide. What are the learning objectives of arthritis? Why we are learning about this topic here for today? That we will know in this slide. Here, what in this topic and in this discussion, we will review definitions. We understand what arthritis is, and then we go to the classification. We see what types of arthritis happens, what are the risk factors, means because of which reasons this condition can occur, this disease can occur in the patients. Then we read what is the pathophysiology of this disease, and then what are the clinical features are there to diagnose the disease, what are the complaints diagnose this condition in the patients, that we will learn later on. We will also learn about the treatment of the disease and how to prevent it. If the patient is not having the disease but prone to get the disease, then what are the preventive things, actions patients people can take to avoid the disease, that we will discuss in this discussion today. And and if rehabilitation of arthritis, if patient got arthritis, what rehabilitative measures they can take to live a healthy lifestyle, that also we will discuss in this topic here. So let's begin with the definition. We also already gave an introduction about what arthritis is, but here it is the definition of arthritis. Arthritis describes inflammation or degeneration of joints leading to discomfort and limitations in daily activities. More than 100 conditions are included. In this, more than 100 types of arthritis conditions are included by the term arthritis, and here in this definition it explains that it is a degeneration of joints. If they becomes defective and start deteriorating and degenerating, then this condition happens, and it also creates a discomfort because the patient shows complaints of inflammation, swelling, redness and pain in the joints. If moving the joints, or even though in if even if they are not moving joints, they have the complaint of discomfort, and because of this their daily activities get limited and they may not move the joints properly and show complaints. So these all things occur in this disease condition. So now, classification. Major forms include osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gout, ankylosing spondylitis, juvenile idiopathic arthritis, and septic arthritis. Here, these are the major forms of arthritis. Osteoarthritis mainly happens in the bones of the bones of the patient. If there is any defect in the Mm, the arthritis happens in the bones. It is called as osteoarthritis. Rheumatoid arthritis mainly occur in elderly patients, and whatever the knee complaints they have, that comes under rheumatoid arthritis. And psoriatic arthritis here, because of some other skin-related conditions or some other conditions, also arthritis develops, which is known as psoriatic arthritis. And gout, it is also a deficiency condition in which, because of mineral deficiency, individual or patient develop arthritis, which is known as gout. And ankylosing spondylitis, because of in this condition, what happens? Posture of the patient get affected, and juvenile idiopathic arthritis, because of some genetic disorders. If children also have some arthritic symptoms, bone disorders that come in this type of arthritis. And septic arthritis, septic because of infection, if arthritis occurs, that is known as septic arthritis. So these are the major classifications of arthritis that come to the epidemiology. Arthritis is a leading cause of disability worldwide. Worldwide, many people have arthritis. Aging population and obesity contribute significantly to increasing prevalence. So here, what happens? Because, as I told earlier, because of the aging and in some cases because of obesity, um, increase in weight also leads to arthritis in the patients, because of increased body weight. And whatever the severe body weight increases, then all stress on the bones definitely increase. Later on, it will increase the stress on the joints, and disease symptoms may appear. So, what are the risk factors of this condition? Age, obesity, genetics. Sometimes due to genetics also arthritis happens. Smoking, whatever smoking bad habits are there, they anyhow they make human body sick, and develop different types of conditions. They also develop defects in the bones, and can lead to arthritis. Joint injury, because of injury also. Repetitive stress, continuously if individual is doing same task and repetitively they are moving, because of wear and tear also, sometimes disease occurs. So repetitive stress, infection, and autoimmune disease, because of some other autoimmune conditions also arthritis may develop, that is known as autoimmune disease. And metabolic disorders increase risk if the individual is not a healthy diet, proper amount of food with all necessary vitamins and minerals, and balanced diet. If they are not taking, that also may, or in some cases, even though they are taking balanced diet, if the body is unable to utilize whatever the good products in their food they need to utilize, then also condition this disease condition develops. So that also may be a risk factor for the disease. Now, come to pathophysiology. What happens that cartilage breakdown, synovial inflammation, cytokines release, bone remodeling, and immune activation contribute to the disease progression. Because of the cartilage breakdown, sometimes cartilage get break. And in synovial means some in joints also, sometimes because of any reason, if inflammation occurs because of injury, because of wear and tear, because of uh, in, before because of sepsis, because of because of mm, accumulation of minerals. If synovial inflammation occurs, then also it can develop the disease. Cytokine release happens in the inflammation condition. Bone remodeling, if bone get degenerated, properly or wrongly modified, then also it produce resistance and can cause disease. And immune activation contribution, sometimes autoimmune, because of autoimmune reason also a disease can occur, then it can lead to the disease. So this is all about the pathophysiology of the disease. Now, what are the clinical features? So we have to see these clinical features in the patients who have the complaint or of the disease. So what are the complaints we can see in the patients? They say the complaint of joint pain. If we observe the patient at the joint, we can see the swelling and stiffness. Warmth is present. The particular location where we see swelling or stiff or inflammation, that will be more tender, and reduced movement. Patients stop moving the joint. They say they feels difficult to move this joint. They have problem in the movement of the joint. They stop doing so. uh, and they also have the complaint of fatigue and functional impairment. They say we cannot move this, we cannot hold this still like this object, we cannot move like this joint. So they show all these symptoms. These are only the clinical features of the disease to know about and get it diagnosed with the condition. So now come to the osteoarthritis. It is characterized by cartilage degeneration and osteophyte formation, commonly affecting the knee, hips, and hands and spine. Mostly osteoarthritis affects knees, hips, hands, and spine. Now, what is rheumatoid arthritis? It is an autoimmune disease causing chronic symmetric polyarthritis, morning stiffness, erosion, and possible systematic manifestations occur in this condition. So, mainly we have to remember rheumatoid arthritis is an autoimmune disease, and it can cause chronic systemic polyarthritis. In this condition, what happens? Patient have complained in the movement of joints, pain in all over the body. They say in the knees, in the hands, in the fingers, or everywhere in the spine. Everywhere they show they are having pain. They have some problem in movement, and all these complaints they show. So we can say it can cause because of the rheumatoid arthritis condition. So, come to the diagnosis. Diagnosis mainly relies on the history of the patient. So, we have to ask the patient: do you have any problem? Have you shown to any other doctor because of the any of the previous condition? We have to ask the patient. If they say yes, previously we showed to this doctor because we had this complaint there, this pain, and because of this reason. So we have to collect the detailed history of the patients. Then we have to do physical examination. We have to see whether the patients are really having the condition or not. We can also do some laboratory tests, and imaging, x-ray also can be advised to the patient if required, and occasionally synovial fluid analysis also can be done to diagnose the disease. So, what are the laboratory tests we usually do to diagnose the disease? That is ESR, CRP, rheumatoid factor, anti-CCP antibodies, complete blood count, CBC, uric acid, and autoimmune marker assist the evaluation of the disease. So now come to the imaging. In imaging, as I told earlier, X-ray detects joint spacing, space narrowing, and erosions, while ultrasound and MRI identify early inflammatory changes. Because if we have to detect the disease early, then we can ask the patients to get done with USG ultrasound. Uh, ultrasonography, and we can ask the patient if they can do MRI also, and and later on X-ray if also detects the disease. Now, what is the medical management? What are the medicines can be given to the patients who are suffering with the disease, and how to manage the patients who are diagnosed with the condition? In the treatment, we can give them analgesics because they have complaints of pain and inflammation. We can give them NSAIDs, corticosteroids, DMARDs, biologics, and disease specific medications with regular monitoring. So non-drug therapy. Now come to non-drug therapy. Besides medication, what are the things we can advise to the patient so that they it will help them to control the disease? We can ask the patients to do exercise. We can advise the patients to go for physiotherapy, if physiotherapy, and we can also ask the patient for occupational therapy, weight reduction, patient education. We have to explain the patient why they are having the disease, how to control the disease. We can also suggest them some lifestyle changes, have a balanced amount of diet to reduce the weight, and also we can give them assistive device, improve outcomes. Some assistive device also nowadays available in the market which support the patient and relieve the provide a sort of relief, instant relief. So we can advise them those devices also to uh, improve their treatment. Now, come to surgery. Advanced diseases may require joint replacement, synovectomy, tendon repair, or corrective osteotomy after conservative failure. If the condition deteriorates, then it is required to go for the option of surgery, where the mostly patients prefer to do uh, joint replacement, and they then they give a relief, the relieving feedback from the disease. Mostly in other cases, surgery includes surgical treatment includes synovectomy, tendon repair, corrective osteotomy. So, okay. Now, what are the complications of this disease? Complications, if the patient is not repaired, not treated properly, they have then they will have chronic pain every day, every time, while sleeping, while waking up, while going anywhere, walking, or doing any other daily functions. They suffer with pain. This is the complication of the disease if not treated properly. And they also may develop deformity. Then they also can develop disability. They quit the task, they stop doing everyday activities because of the pain. And osteoporosis is also develops in the patient, which further deteriorates the condition. Cardiovascular disease can occur. People in mentally, the patient may go in depression also, because they are not getting good treatment, or they are not the disease symptoms not disappears. Then the patient can go to depression also, and reduced quality of life may occur. So, prevention. Now come to prevention. How to prevent this disease? Usually, we have to suggest the people and individuals to have a healthy lifestyle from their early age. We can ask the patient, don't get injury. And smoking cessation also can be advised. We need to ask the patients to maintain a good weight, have a BMI, healthy BMI, and if the patient have the symptoms or environment to get the disease, then we can early diagnose the disease, and we can reduce the risk burden, and we can avoid further complications in the patients by making the patient by early education, patient education. We can ask how we can tell them how to reduce the disease burden, how to prevent the disease. Now come to the case management. Here we are seeing a case in which a patient with chronic knee pain and obesity, and cryptus illustrates typical osteoarthritis diagnosis, and multidisciplinary management. Here in this, it is a case summary. Mm, Here what it is said that a patient with chronic knee pain who is having a chronic knee pain and obesity, and he is also having obesity, and Cryptus illustrates Cryptus illustrates Cryptus, obesity and Cryptus. They have these symptoms which illustrates the patient is having typical osteoarthritis. It concludes that the patient is having arthritis, diagnosis, and multidisciplinary management. Here, a multidisciplinary management is required because the patient need to have physiotherapy, the patient need to have medical therapy. If the condition gets deteriorated, then we can ask the patient for surgery. So here it in and we can ask the patient dietary management. So these all are multidisciplinary things needs to advise to the patient to treat the condition. So they require multidisciplinary management. Now, here, what is the key message? Here, key message is we need to recognize the condition in the patient early. Early recognition is required for the better treatment of the disease. We can give individualized treatment to the patient because every patient is unique and require unique treatment. We can ask the patient for rehabilitation when the patient already develops the disease and suffering with that. We can advise the patient to do some lifestyle modifications, and later multidisciplinary care is always required in this condition, who is so that we can get optimal arthritis outcomes are essential. Multidisciplinary care are essential for optimal arthritis outcomes. If the patient already develops the arthritis, then multidisciplinary care is required to the patient. So it's the end of the today's discussion about the topic of arthritis. So hope you enjoyed the topic. Thanks for watching.